Well, thank you very much. And I'm very glad to be here with my colleagues, Minister Anand, Dr. Tam, and Dr. Njoo to update Canada's situation on COVID-19. 2 weeks ago, we presented a federal roadmap to Canadians to ease restrictions, and we have seen improvements since that time. More Canadians are getting vaccinated. Average case counts are now less than half what they were in mid-April, and the number of people in intensive care is going down. And this is very encouraging news. It gives us hope for a better summer. However, the message you'll hear from Dr. Tam in a minute or so is a very important one. We need to stay the course. We can see the finish line, but we need to stay the course, even when we have this encouraging news in front of us. Les restrictions en place à travers le pays commencent à être levées de manière prudente. Il faut continuer à suivre les règles de la santé publique pendant ces changements pour protéger notre famille et nos proches. Je passe maintenant la parole à Ministre Anand.
Merci beaucoup, Patty, et bonjour tout le monde. Je suis ici aujourd'hui pour une mise à jour sur les livraisons de vaccins. As of yesterday, more than 26 million doses of COVID-19 vaccines have arrived in Canada. Also, as of yesterday, more than 22 million of those doses have been administered by the provinces and territories to eligible youth and adults. Between now and the end of June, we have confirmed delivery dates for a total of at least 15 million more doses from 3 suppliers. So we are well on our way to ensuring that there is sufficient vaccine for every eligible Canadian to receive at least 1 dose of vaccine before the end of June, and that every eligible Canadian will have access to a second dose before the end of the summer. Now for information relating to individual vaccine suppliers. Pfizer, 2.4 million doses from Pfizer will arrive each week over 5 weeks in June, and 9 million more doses will arrive in the month of July. Moderna. As mentioned yesterday, Moderna has provided an updated delivery schedule for its vaccine doses for the first part of June. We can expect 500,000 doses to arrive in Canada in 2 shipments starting next week. In addition to this, there will be 1.5 million doses arriving in the country the week of June 14th. I would like to be clear on this point. Moderna assures us that there will be millions more doses arriving in Canada before the end of June. Nous continuons à travailler avec la société pour établir des dates de livraison et des quantités précises. Nous vous tiendrons au courant de ces détails dès que nous les aurons, comme nous l'avons toujours fait. AstraZeneca. Pour le vaccin AstraZeneca, il est confirmé qu'une cargaison d'1 million de doses supplémentaires arrivera au Canada à la fin juin. Et nous continuons de négocier avec tous nos fournisseurs pour que les livraisons arrivent encore plus rapidement au pays. L'équipe de ESPAC continue de travailler chaque jour pour faire avancer les doses et stabiliser les calendriers de livraison. Le marché mondial des vaccins reste extrêmement volatile et hyper concurrentiel. On ne considère rien comme acquis. In closing, I would like to note that this time last year, I was providing you with regular updates on the progress of obtaining PPE and other vital medical supplies. I said at that time that Canada was aggressively pursuing suppliers and diversifying our supply chains, and we were working to meet the urgent needs of Canadians and to ensure that Canada was prepared for future waves of the pandemic. And it worked. We procured 2.7 billion items of PPE for Canadians and built up Canadian supply chains for these goods as well. Now, with vaccines, we have been and continue to pursue a similar approach, providing supply for the immediate needs of Canadians while also ensuring that Canadians will have access to vaccines for future needs as well. Our work is not complete yet, and I want to assure Canadians that our government is continuing to bring in vaccines in an era where supply chains are very volatile. Finally, for a personal update, 3 out of my 4 children have been vaccinated, and the other one, with encouragement from her mother, is going to have hers as soon as possible. Thank you. Merci. Miigwech.
Merci. On va maintenant tourner au docteur.
Bonjour à tous. Today, we'll provide an update on the national epidemiology and modeling work that informs the ongoing management of COVID-19 in Canada. Over the past month, things have taken a great turn for the better, and we've doubled the number of COVID-19 vaccines administered from 10 million doses given as of late April to now over 22 million doses given across the country to date. At the same time, our efforts have got us well and truly over the peak of the third wave nationally and heading for a much better summer if we can stay the course. On slide 1, today we've been seeing strong and steady declines in disease trends, and barring any increases yet to be seen from activities over the long weekend, the decline continues. Average case counts are now less than half what they were during the peak of the third wave in mid-April, with under 3,400 cases being reported daily over the past 7 days. And the number of people experiencing severe and critical illness is also decreasing, though at a slower pace, as overall infection rates come down. The latest 7-day average for the number of people with COVID-19 being treated in our hospitals each day has dropped by 34% since peak activity to about 2,900 daily. Of these, an average of under 1,200 were being treated in intensive care units, and there were an average of 43 deaths reported daily.
Bonjour à toutes et à tous. Si on avance à diapositive 2, à l'échelle du pays, grâce à des restrictions soutenues dans les régions les plus lourdement touchées, la tendance de RT est inférieure à 1 depuis le mi-avril, ce qui signifie que chaque centaine de cas au Canada transmet le virus à moins de 100 autres personnes et ainsi de suite, chaque nouvelle génération de propagation devenant moins importante. Cela signifie que l'épidémie a cessé de croître dans les régions les plus touchées.
On slide 3, COVID-19 infection rates have peaked in most areas, followed by the slower decline in hospitalization rates. However, where infection rates are still very high, such as in Manitoba, hospitalization rates have not yet begun to decline. With an average length of stay of 2 weeks for people hospitalized with COVID-19, or close to 3 weeks for those experiencing more severe illness, the number of hospitalized patients accumulates over time, placing a heavy strain still on healthcare capacity where infection rates remain high.
Diapositive 4. Les variations génétiques des virus sont courantes et attendues. Un variant préoccupant, ou VP, peut être plus contagieux, provoquer une maladie plus grave ou avoir un impact sur les tests, les traitements ou les vaccins. 4 VP détectés à ce jour au Canada sont maintenant responsables d'environ 70% des cas récemment signalés, dont la plupart sont le variant B117. Tous ces VP sont plus contagieux et les preuves démontrent que les variants B117 et B1617 sont au moins 50% plus transmissibles. Les variants P1, B1351 et B1671.1 présentent des mutations génétiques communes sur une partie du génome du virus qui pourraient avoir des répercussions sur l'efficacité des vaccins. Cependant, les données étant limitées, il est difficile de déterminer précisément ces répercussions pour le moment. C'est pourquoi nous devons demeurer vigilants. Il y a moins de marge d'erreur avec des variants qui se propagent plus rapidement et la possibilité que les VP réduisent l'impact des vaccins. Bien que nous continuions à surveiller et à évaluer les impacts des VP au Canada, nous savons que, dans l'ensemble, la protection vaccinale reste substantielle contre les variants et que les vaccins, combinés à des mesures de santé publique et individuelles, permettent de réduire la propagation de la COVID-19.
On slide 5, more than 22 million doses of COVID-19 vaccines have been administered across Canada since vaccination began in mid-December, providing 62% of eligible Canadian adults with at least one dose of COVID-19 vaccine. Notably, Indigenous communities and the territories have made excellent strides in increasing vaccine coverage. To date, more than 3/4 of adults in the 3 territories have received at least one dose of COVID-19 vaccine, and 66% have received 2 doses. A first dose of COVID-19 vaccine provides us with priming protection. But for maximum protection, we must get a second immunity-boosting dose.
Diapositive 6. Les hospitalisations chez les adultes de 80 ans et plus ont diminué de façon marquée après le sommet atteint pendant la deuxième vague, à la suite de l'administration des vaccins à ce groupe d'âge à risque élevé, et ils sont restés relativement faibles tout au long de la troisième vague. Depuis le milieu ou la fin du mois d'avril, les hospitalisations ainsi que les admissions aux soins intensifs se sont mis à diminuer chez les adultes de 60 à 79 ans. La couverture vaccinale dans ce groupe d'âge a atteint 60%. Toutefois, comme les taux d'infection restent élevés chez les adultes âgés de 20 à 39 ans et de 40 à 59 ans, les hospitalisations ont plafonné ou commencent tout juste à diminuer respectivement dans ces groupes d'âge.
On slide 7, with millions of vaccine doses administered, there have been relatively few cases reported in people who have received at least one dose of COVID-19 vaccine, and fewer still amongst those who have received 2 doses. Remember, vaccines take time to work, including up to 14 days after the first dose to provide good protection, and up to 7 days after the second dose to provide strong protection. Based on data provided by 9 provinces and territories up to May 25th, people with infections occurring 14 days or more after their first dose account for 0.15% of people who have received at least one dose of a COVID-19 vaccine. Compared to unvaccinated cases in these jurisdictions, these individuals were more likely to report no symptoms and less likely to experience severe illness requiring hospitalization. This aligns well with vaccine effectiveness studies showing strong protection against severe illness.
Diapositive 8. D'après les données canadiennes allant jusqu'au 21 mai, les prévisions à court terme montrent les cas et les décès prévus attribuables à la COVID-19 jusqu'au 10 juin. Le graphique de gauche montre que le nombre de cas prévus pourrait se situer entre 1 387 210 et 1 426 400 d'ici le 10 juin. Le graphique de droite montre que le nombre de décès prévus pourrait se situer entre 25 590 et 26 310 d'ici le 10 juin.
Slide 9. This updated longer-range forecast shows how the epidemic trajectory may evolve through the middle of June, taking into account both the effects of variants of concern and vaccination. The good news is that nationally, we expect the third wave to continue to decline along the gray line trajectory, as long as we maintain current measures and don't increase in-person contact rates across the community. This downward trend shows that measures put in place across the country are working to suppress the third wave as vaccination continues. While this forecast is very encouraging, it reaffirms that now is not the time to relax our measures. If measures are relaxed, increasing the number of community-wide in-person contacts, resurgence is likely.
Diapositive 10. L'expérience d'autres pays souligne la nécessité de maintenir les mesures de santé publique strictes au fur et à mesure que les vaccins sont administrés à une majorité de la population et d'assouplir les mesures de manière contrôlée et progressive à mesure que les taux d'infection par le COVID-19 diminuent. Au Royaume-Uni, où les niveaux d'immunité naturelle sont plus élevés et où 70% des adultes âgés de 18 ans ou plus ont reçu au moins une dose et près de 45% sont totalement immunisés, les mesures sont assouplies lentement et prudemment. Il est important de noter que le Royaume-Uni a maintenu les mesures strictes jusqu'à ce que les taux d'incidence soient plusieurs fois inférieurs à ce qu'ils soient actuellement au Canada. Bien que les pays ayant des taux de vaccination élevés fassent de grands progrès, certains ont connu des recrudescences en cours de route. Par exemple, le Royaume-Uni connaît encore des zones actives de la maladie, alimentées par des variants préoccupants dans les régions à faible couverture vaccinale. Au Canada, le lever progressif et prudent des mesures restrictives peut se faire en toute sécurité une fois que les taux d'infection sont faibles. Nous devrons demeurer vigilants partout pendant que les vaccins continuent à renforcer l'immunité de la population canadienne.
Slide 11. More complex modeling continues to help us in examining different scenarios for lifting public health measures based on the interplay of factors such as vaccine rollout, vaccine coverage levels, and the impacts of variants of concern. The last time we presented, we showed a scenario where 75% of the adult population aged 18 years or older had received a first dose of vaccine, and at least 20% had received their second dose. We've now updated this modeling to include everyone aged 12 years or older, for whom at least one COVID-19 vaccine has been approved for use in Canada, and to show the additional benefits of more people becoming fully vaccinated. This updated scenario shows that the most restrictive public health measures, such as lockdowns, may be lifted this summer, the first vertical blue dashed line, when 75% of the population, 12 years or older, has had one dose, and at least 20% have had two doses. Though we will still need to maintain individual precautions, such as masking and spacing around non-household members, we'll be able to gather in smaller groups outdoors, dine on restaurant patios, and safely enjoy outdoor activities. As vaccine rollout expands further towards the fall, and once 75% of the population aged 12 plus are fully vaccinated, that second vertical blue dashed line, it may also be safe to begin easing personal protective measures without overwhelming hospital capacity. The updated modeling shows that taking a phased approach and including the 12 to 17-year-olds in Canada's vaccination rollout will make it safer still to lift restrictive measures and individual precautions. While this modeling gives us targets for planning, decisions can't be based on vaccine coverage alone. Ultimately, jurisdictions will need to make decisions about lifting restrictive public health measures based on data and their own local circumstances.
Diapositive 12. Même si la première phase du déploiement des vaccins visait à vacciner les populations les plus vulnérables, y compris les adultes plus âgés, nous devons ultimement atteindre des niveaux élevés de couverture vaccinale chez tous les groupes d'âge pour être en mesure d'assouplir en toute sécurité les mesures et de profiter d'un automne plus normal. Ce scénario indique que si seulement 50% des adultes âgés de 20 à 44 ans sont entièrement vaccinés, nous pourrons observer une recrudescence des cas lorsque nous leverons les mesures de santé publique, ce qui pourrait entraîner le dépassement de la capacité hospitalière à l'automne ou à l'hiver. Les personnes plus jeunes sont un facteur important de la transmission et ce modèle indique qu'elles représentent un élément essentiel d'une campagne de vaccination fructueuse. Plus les jeunes personnes se feront vacciner, plus nous serons en mesure de contrôler l'épidémie efficacement. Nous savons que de nombreuses jeunes personnes dans l'ensemble du pays attendent avec impatience la chance d'être vaccinées. La bonne nouvelle est que votre tour est arrivé et le modèle montre que votre participation compte. En relevant vos manches et en vous faisant vacciner aussitôt que vous le pouvez, vous nous aiderez à atteindre un taux sécuritaire de 75 qui nous permettra de lever plus facilement et en toute sécurité les mesures en vigueur dans l'ensemble de nos communautés.
Slide 13. Fortunately, we are seeing very encouraging levels of vaccine uptake, with over 26 million COVID-19 vaccine doses delivered to date, and Canadians continuing to roll up their sleeves as vaccine clinics expand across the country and vaccine coverage is increasing rapidly. First dose coverage is now above 85% for those aged 60 years or older, and over 90% of adults aged 80 or older have received at least one dose. This is an incredible accomplishment and speaks to the high levels of vaccine confidence among Canadians. Extending the interval between the first and second doses has allowed many more people across the eligible adult population to gain good protection with their first priming dose of immunity. Getting both your first and second vaccine dose as soon as it's available to you is important for everyone to have the best shot at achieving strong protection against COVID-19 and for building up an optimal level of protection across our communities to support the safe easing of restrictions. Success is within our reach. However, we are not at our targets yet, and we still have a ways to go before we can safely ease measures without risking a resurgence that could overwhelm healthcare capacity.
Diapositive 14. Avec une baisse constante des taux d'infection et une solide augmentation constante des taux de déploiement et de la vaccination, nous sommes sur la bonne voie pour respecter les mesures et les conditions essentielles qui nous permettront de profiter d'une plus belle été. Par contre, il ne faut pas arrêter à mi-chemin. Plus le nombre de personnes entièrement vaccinées sera élevé, plus il sera possible de lever les mesures de santé publique restrictives dans la communauté, puis de relâcher les précautions individuelles, ce qui nous permettra de revenir à des interactions, des routines et des activités plus normales, notamment de passer plus de temps ensemble à l'intérieur. Entre-temps, alors que le taux d'immunité continue d'augmenter au sein de la population, il est très important de continuer à respecter les conseils de santé publique locaux, notamment quand et à quel endroit il faut maintenir les précautions essentielles comme le port de masque et la distanciation. Rapidement, ensemble. Merci.
Merci. Nous allons maintenant prendre des questions. We will now take questions. On a environ 30 minutes. We have about 30 minutes. We'll do one question, one follow-up, and I will now turn to the operator. Je tourne maintenant à l'opératrice pour prendre la première question, s'il vous plaît.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Kevin Gallagher, CTV National News. Please go ahead, à vous la parole.
Hi, thank you for taking our questions. My question's for Minister Hajdu and perhaps Dr. Tam. The Federal Science Advisory Board came out with some other travel recommendations, notably doing away with hotel quarantines, as well as putting in other conditions for vaccinated travelers, depending on how many shots they've had. You said in the past that your government bases its decisions on science. When will you do away with hotel quarantines for travelers?
Well, thank you, Kevin, for the question. And maybe I'll start and then turn to Dr. Tam. First of all, I want to thank the testing and screening panel for their incredible work. Certainly, the issue of international travel, as you know, is a delicate and contentious one, and we want to make sure that we continue to protect Canadians from the risk of importation of virus, no matter what measures we have at the border. And so this report provides us with a roadmap, if you will, of the next steps that we can consider as we begin to see an increased protection of Canadians through vaccination and the reduction of COVID-19. And maybe I can turn to Dr. Tam because I know she's been working with her domestic counterparts, medical officers of health from the other provinces and territories, to say a few more words.
Yes, I think we thank the panel for providing their advice, and certainly it's an important report with the recommendations that we need to consider and take into account for those the next forward path. I think part is to recognize the very important role vaccines play, and that very fortunately there's a number of very good vaccines that are effective and safe globally. But as we all know, global vaccination coverage is not, very high at the moment, but many countries are making significant progress. So we will be certainly looking at different indicators, and some of that includes how Canada itself is doing. Because when a country is still in the middle of a third wave and we haven't as yet attained a good level of immunity from a population perspective, then it's more difficult for us to tolerate importations and to be able to manage any of those kind of scenarios. And so I think our next stages will take into account the what's happening inside Canada, both from that epidemiology, disease activity, as well as where we are with our own vaccinations. But nonetheless, I think it's very important to take into account vaccination as part of the layers of protection for international travel. And this is very much a subject of active discussion. And yes, we will be certainly laying a path forward in the near future. Thank you.
Follow up, Kevin?
Right. But outside of the vaccination rate, this report does clearly indicate that it finds the hotel quarantine format problematic and really at times ineffective. It's easily bypassed by travelers that have now gone across the border, sometimes by foot. The 72-hour stay period really doesn't have much to do with the incubation period of the virus. At the time that this decision was made to put in the hotel quarantine regime for international travelers, what science was that decision based on? And does this report cast doubt on the science used at the time to make that decision?
So maybe I'll start. There's layers of protection being put at the international border. And I do think that each layer added together provides a robust international border protection. So it's nothing to do with the incubation period as such, but I do think that if someone's had a pre-boarding test and they've got a vaccine, the chances of anyone transmitting before we know the results of that first test en route to their homes, en route to their final destination is going to be small. And I think as the Canadian epidemiology improves, we can tolerate those kind of risks. I think they're minimal. So, which is why I think we absolutely welcome the report from the expert panel, and that we should take this into account. But each layer has its different purpose. And so if someone, for example, catches the virus for whatever reason and wasn't before departure and they didn't pick it up through the pre-departure test, they come into Canada, they take the first test, but they don't know the result. There's always some risk. It's never 100% proof. But I think, again, each layer is imperfect, but added together, I do think pre-boarding tests and the vaccination, for example, affords a great deal of risk reduction. And we should take their recommendations into account as we move forwards.
Prochaine question, s'il vous plaît.
Thank you. Merci. The next question is from, la prochaine question est de Christian Noël de Radio-Canada. Please go ahead. À vous la parole.
Bonjour, merci. Pour faire suivi à mon collègue Kevin, malgré les recommandations du rapport, j'essaie de comprendre d'abord pourquoi maintenir les quarantaines dans les hôtels alors qu'elles sont inefficaces, comme dit le rapport, pourquoi elles demeurent nécessaires selon vous, mais surtout, de façon claire pour monsieur, madame, tout le monde, quels seront les facteurs qui devront être mis en place avant qu'elles soient retirées, ces quarantaines?
Je ne sais pas, est-ce que le ministre Hajdu veut commencer ou est-ce que moi je commence à...
I can ask it in English as well.
Peut-être vous, Dr. Njoo, et après ça, moi.
OK, bon, peut-être je répète aussi que Dr. Tam a constaté, avec ce qu'on fait avec les mesures à nos frontières, c'est vraiment des couches de protection. Si on parle spécifiquement avec la quarantaine, avec les hôtels, c'est pas toute la période de quarantaine, c'est seulement une étape dans le, comme on dit, un voyage d'une voyageur ici au Canada qui arrive, parce que c'est vraiment en attendant le résultat de le dépistage on fait à la frontière. Donc, c'est toujours le principe avec la période d'incubation. La période de quarantaine ou la période d'incubation, c'est 14 jours. Mais pour la gestion des risques, on a fait, comme on dit, une période dans les hôtels pour attendre le résultat d'un dépistage on fait aux frontières. Mais c'est sûr, au futur, on va modifier, ajuster selon aussi le rapport avec les experts parce que au Canada, la situation épidémiologique continue à améliorer et aussi la couverture vaccinale. Donc, ce n'est pas seulement une question avec les voyageurs qui arrivent à nos frontières, c'est aussi c'est quoi les niveaux de protection ici on a au sein du pays avec la population canadienne. Et c'est sûr, on va continuer à suivre les données probantes pour ajuster, mais en effet, on accepte comme des recommandations des experts parce que c'est comme le ministre a constaté, c'est comme une carte, c'est comme un roadmap pour nous guider un peu qu'est-ce qu'on peut faire pour les prochaines étapes à la frontière. Et c'est toujours une situation fluide et c'est dans un bon sens parce qu'on continue avec nos vaccinations dans toutes les provinces et territoires. Et les situations épidémiologiques continuent à améliorer ici aussi au Canada. Merci.
Suivi, Christian?
Well, I didn't really get an answer to my question, so I'll ask it in English, and we'll see if maybe Minister Hajdu would like to answer to that one. But there hasn't seemed to be any science at the beginning when the quarantine in the hotel has been put. And I guess my question is this: was it just a public relation stunt or a public relation decision that was made? And if there was scientific factors to put it in place at the time, what are the scientific factors that you're going to be looking at when it's going to be time to remove that 3-day period in the hotel? Thank you.
Oh, merci pour la question. Nous devons avoir les conversations avec nos homologues provinciaux et territoires. C'est un enjeu qui a affecté leur population très profonde et c'est une décision nous devons prendre avec les provinces et territoires. I would just say this, it's important that we have an opportunity to discuss the results of this report with the provinces and territories. Obviously, their domestic situation is important to contextualize. It's also, I will say at the beginning, it was a reflection of the fact that PCR tests take some time to come back. And when people were flying into international airports, onward travel to smaller jurisdictions, we wanted to be able to have the results of those PCR tests before they continued on in another airplane to their smaller communities. And as you know, those measures were put into place after a lot of conversation with provinces and territories who wanted stronger measures to protect, in particular, air travelers who are traveling en masse in an airplane with each other, and then disembarking and then reboarding on another airplane together. And so, given that everyone was very interested in arrival testing, this approach was recommended as one to ensure that we could, in fact, get those tests back before the onward travel. Now, the report is recommending that may not be necessary given the change in our own vaccination rate, given the change in our own domestic COVID situation. And these recommendations are going to be very helpful as Dr. Tam and Dr. Njoo have those conversations with their counterparts.
Prochaine question, s'il vous plaît.
Thank you. Merci. The next question is from La prochaine question est de Mike Lecouteur, Global News. Please go ahead. À vous la parole.
So I hate to continue to hammer on this point, but I guess to Dr. Tam and to Minister Hajdu, if we're not looking at making the changes today, and as you say, we do need to consult with the provinces and territories, what specific markers need to be in place before doing away with this whole hotel quarantine and to loosen those rules for those who are vaccinated, especially since I want to reference what Dr. Tam said, in terms of the pre-boarding test and one vaccine being good protection. Is that a bit of a hint of where you're going with this? So if I could get an answer on when you'll make the decision, what are the markers you're looking for, and could it be that someone with one vaccine and a pre-boarding test could avoid staying in a hotel?
Perhaps I can turn to Dr. Tam for that, as there's a lot of technical aspects to that question.
Yes, no, I think the vaccines are a game changer, I think, in the area of border health and the layers of measures. So absolutely, I think in my discussion with the chief medical officers, you know, in the area of vaccination and proof of vaccination records and all of this demands thoughtful consideration. But I think the provinces and territories, at least at the chief medical officer's health level, recognizes that vaccines will play a role for the international border. This is nothing to do with the domestic use of vaccine proof. It's just that it's a reality as well that other countries are going to be looking at this as well. So absolutely, some of the public health considerations does include some of those markers that you've seen in the modeling presentation, which is that I think this country can address any residual risk from travel, particularly from really vaccinated individuals, when our third wave is well under control, when our vaccination coverage is high. We still have to discuss, you know, between the 1-dose population coverage to the 2-dose population coverage, which hopefully is not a big gap. What do you do in between, right? So your maximum, not only individual protection, but community protection in Canada is best afforded when people have had the 2 doses. And what you do between now and then needs careful consideration. The other parameters, vaccine effectiveness. Vaccine effectiveness in general is good with the vaccines approved in Canada. And we need to, of course, define what being vaccinated means with which vaccine and whether 1 dose or 2 dose. 2 dose, of course, is what we would essentially consider as being fully vaccinated. And as I've said, domestic capacity, but also domestic capacity to test, sequence, and trace, and absorb any potential introduction and sparks that you know might be coming in through international travel. But for sure, full vaccination, for example, in a traveler, will afford a significant layer of protection and will be a significant factor in our shift in the border stance moving forwards. I said it is not it is quite a complex space and needs thoughtful consideration, but as we move towards the next weeks and months with more and more vaccinations inside Canada, I think we will be able to have a lot more flexibility at that border. And it should be data informed. The good thing is that right now we also have the border testing on arrival where we can sequence the viruses. And if we do continue the testing for vaccinated individuals, for example, we can see if they are positive, whether they're carrying something that potentially has vaccine escape potential. So we have to work through the layers of protection again to see which ones we can remove without significantly impacting the safety for Canadians. But I am certain we'll be hearing more about this space in the coming weeks.
Follow up?
Yeah, Dr. Tam, I just wanted to note something while you were talking about the forecasting. You said while the forecasting is encouraging, now is not the time to relax measures. You're saying that on the same day that Quebec is opening patios and a day after or in the same week that Alberta is planning the Calgary Stampede. How do you feel about seeing jurisdictions move so quickly to reopen when you yourself are saying now is not the time to relax these measures?
Dr. Tam, you're muted.
Yeah, I'm advocating a pretty precautionary approach because, well, we've seen on that same curve what happened when we started relaxing measures on that second wave on the way down, probably about 2/3 of the way down or just over halfway down. And we got that resurgence and the biggest wave that we have experienced, that is the third wave. We know the vaccines are going to help, but we haven't got the one dose into everybody yet. And the curve is only, just over 50% reduction from the peak. And we've seen what happens even in the United Kingdom when they've actually reopened once they really got to the bottom of their very big wave. So it is an absolute note of caution. Now, patios and outside spaces are, of course, less risky. So beginning with those spaces, people do need to go outside. Those are lower risk areas. And doing that cautiously and then waiting to see what happens before you do your next phase is very much advocated. Now, we gave a national picture, of course. The realities are very much regional. So the provinces do have to look at their own slope and their own epidemiology, and Quebec has their own modelers looking at their situation. And so what they're trying to remove, I believe, the curfew and reopen some outside spaces. So I think that's not unreasonable given where they are, but I would still add a note of caution. If you have pockets of under-immunized population, such as some that are observed in the UK just recently, in the sort of northwest, you might suddenly see a resurgence in under-vaccinated or partially vaccinated populations fueled by some of the variants of concern. And so then you got to move in really quickly and address those pockets of resurgences. So that to me is very much in the realities of the weeks to come for Canada. And so that's the overarching national curve. And for Manitoba, it'll be very different, of course. And the reopening plans are all a bit different based on slightly different indicators, but almost all in the same ballpark of trying to achieve a very high level of vaccine protection before people can sort of move back into the bigger indoor spaces, for example. So, of course, so I think the bottom line is that we've had a few experiences in the past that has led us to wanting to be more precautionary. Slowly does it in a phased way, is recommended for sure.
We'll take the next question, please.
Thank you. Merci. The next question is from La prochaine question est de Catherine Lévesque, La Presse canadienne. Please go ahead. À vous la parole.
Oui, merci beaucoup. Actually, I'll be asking my questions in English. First to you, Dr. Tam. I wanted to hear from you about the G7 because the Prime Minister will be going to London, it seems. So has his team consulted with you about this? And will he be staying after he comes back from his trip in a Montreal hotel? Is it going to be in a Toronto hotel? And how will the Canadian delegation get back to Ottawa afterwards? Thanks.
Thank you for the question. I am not sort of involved in the details of operations for the Prime Minister, but certainly the delegation can submit their plans to the Public Health Agency and have those reviewed. And of course, there's expectations through the Quarantine Act for individuals, Canadians coming into Canada that needs to be observed from a quarantine perspective. And so, and we expect people to observe the requirements.
Follow-up, Catherine?
Oui, merci. So just to be clear, they have not submitted a plan up till now, if I understand correctly. And I also have another question for Minister Hajdu, going back to the hotel quarantines, because you did say that you had to consult with provinces. In fact, the pressure did come from provinces to actually put in place those hotel quarantines. So if, let's say, Ontario and Quebec say, go ahead, we don't need this hotel quarantine anymore, will the federal government phase out or maybe modify the hotel quarantines afterwards?
Well, those are the conversations, quite frankly, that I'll have with my counterparts and Dr. Tam will have with hers. Obviously, through the Special Advisory Committee, the medical officers of health will be able to provide their perspective on the report and on, evolving considerations for international travel. But certainly I'll be having a conversation with health ministers on the implications of the report and what people's thoughts are in terms of their own jurisdiction and in the country as a whole. So I don't think I can comment yet in terms of what the plan will be because we haven't had that conversation as of yet.
When is it planned?
We have regular biweekly health minister meetings, so I'm sure it will be on the agenda of the next one.
Okay, next question, please.
Thank you. Merci. The next question is from La prochaine question est de Ryan Tumulty, National Post. Please go ahead. À vous la parole.
Yeah, I just want to see if I can get this question put plainly. When do you expect to respond to the recommendation to end hotel quarantine and to change the travel system as it stands?
I think, Ryan, we've answered that question. We are going to take the report, have conversations with the provinces and territories. Dr. Tam will have consultations with the chief medical officers of health. And then when we have a sense of how the provinces and territories feel that their capacity is and their perspective is on the report, then we'll be able to come back with some of those answers.
Ryan, follow-up?
Yeah, I mean, you've talked about a process, but you haven't really talked about a timeline. And there's an airline industry on its heels here that could really use an opportunity to have more people flying. There's a lot of people are waiting for an answer on this, and I'm hearing conversations about a process to it, but no conversations on a timeline to bring that process together.
From my perspective, it's really important that we have those conversations with the provinces and territories so that we gauge their comfort, so that we understand their own domestic capacity and their perspectives on the report. Perhaps, Dr. Tam, if you've had conversations with the medical officers of health, you might want to weigh in, but certainly I have not had an opportunity to discuss the report with my counterparts, and I'm looking forward to it in the very near future.
Yeah, for sure, I will need to have that discussion with the other chief medical officers of health. But if you were looking forward to what is to come in the next months, I do think that some alignment with how resilient the Canadian population is in terms of the vaccinations, how fast we can get to some of these goalposts, if you like, will play into that as well. So I think that it is a very positive picture. I think that we are heading into, if we don't sort of let go too quickly and have to deal with a fourth wave or something like that, we can tolerate more, international travel and people coming into Canada and be able to manage them safely. So, but if you see those kind of timelines and when we might be able to get the Canadian population through that first dose, 20% second dose, and then to be fully vaccinated, that gives you some trajectory, I think, to look at. The other things, of course, we have many different departments around the federal government that have had ongoing conversations about getting ready for vaccine proof. How do you prove that someone, how does someone demonstrate that they have been fully vaccinated, for example, and that it has actually already began. So the foundational work and operational work that goes into those requirements have already been done and is ongoing. And so all these different pieces have to be, of course, in gear to operationalize a shift in the border stance. But I do think that I look at it in a pretty optimistic way.
Okay. We'll take the last question. Ça va être la dernière question, s'il vous plaît.
Thank you. Merci. The last question is from La dernière question est de Mélanie Marquis, La Presse. Please go ahead. À vous la parole.
Merci. My question is for Minister Hajdu. Last week, the government announced the quarantine measures, the obligation to go in a hotel, would be extended until June 21st. So I want to know, is that set in stone despite the committee's recommendations, or you want to keep your options open as far as June 21st goes?
Thanks, Melanie. It's an elegant way to ask me for a deadline. I'll just say the same thing I said to the other reporters, which is I do want to have the conversation with the other provincial health ministers before we make any commitments to changing our stance. I do think the report is very valuable and helpful. And as Dr. Tam said, our domestic situation is improving. But we do still see some provinces that are struggling from a healthcare capacity perspective. Manitoba, for example, has just received extra support from the federal government. It was just a couple of weeks ago that Alberta was in crisis. And so it's very important that I feel that I understand the perspective of health ministers before we adjust measures. And so I think, we can anticipate that measures will be adjusted. The date is the piece that I do need some more time to come back to you with after I have those important conversations with my colleagues.
Suivi, Melanie?
Yeah, I think I'll go with another elegant question for Mr. Hajdu. What could you do until then? Because the committee not only spoke about science, but they spoke about the inadequacy of there existing some loopholes for travelers preferring to pay a fine instead of going to the hotel. Is there something you can do in the meantime while the measure is still in place?
Well, first of all, I would say that obviously on the land border, the mode of travel is very different. And so, of course, people are not traveling en masse in those circumstances and have the ability to travel in private vehicles to private accommodation. And so, we continue to monitor that traffic, and that positivity rate at the border is also, by the way, much lower than at the air border. But I'll also say this: we rely on our provincial partners to help with enforcement. As you know, we have hired private security firms on top of the contact on top of the staff people that we have through Statistics Canada and other departments of the government that are working to make sure that phone calls are placed to all travelers. We have visits now from private security firms. But in fact, we rely on our provincial partners to enforce the Quarantine Act with us. And certainly they have within their power the jurisdiction to be able to apply fines in cases of anybody violating quarantine. And we would encourage all of the provinces to make sure that they have the provisions in place to do that, first of all. And secondly, that those that do, and most of them do, fully utilize the Quarantine Act to their benefit if they suspect that people are not fulfilling the quarantine. As you know, we have been consistently working with our partners to make sure that fines are levied when people are in fact violating those requirements.
Okay, ceci met la fin de la conférence de presse. Bon week-end à tous. That's the end of the press conference. Thanks. Have a good weekend.
Thank you. Merci. The conference